Hi, I'm Dr. Robert Coates. I've been practicing here at WellGroup Health Partners for the last 7 years. I'm a board-certified hand and upper extremity orthopedic surgeon specializing in traumatic and degenerative conditions involving the upper extremity. As part of our orthopedic surgery training, we've been taught that motion is life. All the surgeries that we do are used to stabilize the joint so you can have early weight bearing and functional range of motion. A stiff joint is not a useful joint and it's not good for function at all. So range of motion is the most important thing in orthopedic surgery. I was first introduced to the Dynasplint at University of Chicago during my fellowship, and I've been using it since I've been out in practice for the last 7 years. I've found Dynasplint to be quite helpful for the shoulder, elbow, wrist, as well as the small joints in the hand. Probably the device I use the most often is for PIP extension, because again the PIP joint is just notorious for stiffness. In the Chicagoland area, people insist on playing the 16-inch softball, so they're jamming their fingers all the time. So I see a lot of boutonniere deformities, a lot of intra-articular PIP fractures, and all of those end up with PIP stiffness. You know, every patient is different and every disease condition is different, so you have to really look at your clinical keys. The thing that I look at the most is where do you see the patient in the next week or the next month to determine when you're going to do Dynasplint as an adjunct to treatment. I spend a lot of time with my occupational and physical therapists that give me good feedback to know whether someone's progressing or not. Certain diagnoses such as adhesive capsulitis, you know it's going to take a year or two for that to resolve on its own, so it's better to get in there early to encourage range of motion. It's really a team approach with everything that we do, and the occupational therapists as well as our Dynasplint representatives really play an integral role in the patients being able to achieve maximum function the fastest way possible. For the most part, patients who are highly motivated really enjoy using the Dynasplint because they have some more control and they really feel like they're an active part of their therapy regimen. I get weekly feedback from the occupational therapist, and then I'm in pretty close communication with the Dynasplint representative as well to let me know how long the patients are wearing the device, if the device is working for them, and how the patients are tolerating it. In today's medical community, we're really trying to pay attention to cost savings and getting basically the most bang for your buck. And a lot of times with occupational therapy, we're sending the patients there more for modalities, pain control and edema control, and we really like them to do a lot of the range of motion work on their own. And with the Dynasplint, that allows them to take control of that. And not only is it a cost saving from the occupational therapy standpoint, but also it saves you the time, the gas money going back and forth from therapy. It allows them to have a more normal work and life schedule, so they can just wear the splint and do their daily activities or wear it when they're at home. So overall, it probably does save a few dollars in the healthcare pie. A Dynasplint's just been an invaluable adjunct to my practice.